Anxiety is very common in children. Unfortunately, I see kids coming in and out of our own clinic. I had 2 6-year-olds in about 2 months ago, and their parents told me that the children are worrying excessively. So whenever we think about worrying and anxiety, we have to think about overthinking. There's a lot of mental noise going on in the child's mind. And what's contributing to that? Does poor breathing feed into that? And the answer is yes. Very often these children, they are having their mouth open. If we breathe through an open mouth, it affects the activity and the connectivity in different regions of the brain that is contributing to thinking. Those parts of the brain are called the default mode network. But not only is mouth breathing affecting directly the brain, mouth breathing also affects the nervous system. When we have an open mouth, we breathe faster, we breathe harder, we breathe up our chest, and the brain is spying on our breathing. So the brain weighs up by our breathing pattern whether the body is safe or whether the body is under threat. If we want to bring balance to the nervous system, we have to think about switching to nasal breathing, whether we are a child or an adult, but also improving underlying breathing patterns. A third factor that feeds into rumination of the mind is poor sleep quality. And there is no doubt that mouth breathing reduces the time that we spend in deep sleep. It increases sleep fragmentation. So we spend more time in light sleep. And as a result then, the brain doesn't develop in childhood the way it should do, but also the brain doesn't clean itself. So in terms of deep sleep, the importance of that is that toxins are cleared from the brain during deep sleep, and we know when we've had deep sleep. We wake up feeling refreshed. We're ready to start the day. We have good concentration. We are in a good mood. So let's bring this full circle. So for children with anxiety or with a lot of mental noise, how can we help with that? We have to talk about everyday breathing patterns, using breathing as a tool to be able to self-regulate, improving sleep quality, and giving these children tools that they can use for the rest of their life to help with their mental health.